usually parents will ask,
Yeah.
is my child going to be able to speak?
Yeah.
And of course, like school, they also ask about school. Will these behaviors go away? How long will my child need support?
Yeah.
We will discuss with parents, about the two pathways that generally a child would take.
Yeah.
Whether it's a developmental pathway or versus a more adaptive pathway. 90% of our energy, effort, time should be focused on putting in measures before a behavior happens.
Yeah,
right?
you're not trying to trigger the child to see the autism.
Yeah.
You're trying to set the child up for success to see their best actually. Hi everyone and welcome back to EAP Talks, where we try to have conversations surrounding autism, community and care. And it's me, Jo and Rachel, again from EAP. Rachel is our principal at EAP and I'm the director, and we are in our 20th year of EAP. So that means we are answering some frequently asked questions.
Yep.
Everyone out there, if you put in your comments, your questions on this YouTube, we would love to answer them in future podcasts as well.
Yeah.
So in the last episode, we talked a little bit about some very frequently asked questions that we get over the years.
Yeah.
But today, I wanted to ask you a bit, Rachel, about diagnostic evaluations. So we both have a master's in clinical psychology, and we're both registered clinical psychologists.
Yep.
But Rach, how many DEs? We call it DEs, diagnostic evaluation equals DE. How many have you done? You reckon?
A few hundred. I was just doing
Roughly
a rough
estimating.
count. Maybe 200, 250
Plus? Wow.
Plus, yeah.
I think you've done maybe more than me. Yeah, more
Really?
than me. I
Really?
think I am almost 200, but I'll need to
okay.
look back over the years. So that means, and then cumulatively at our work,
Yep.
we have seen over 1,500 children over the 20 years.
Yep.
So what an incredible opportunity. What an honor that parents trust us and we get the opportunity to work with such a diverse range of children. But that also means that we have a broad experience of meeting different children on different ages, different nationalities, and different ends of the spectrum. And I was just wondering, like, from all the different experiences, I mean, first of all, could you just share again, and I know we've shared it before, but what actually takes place in a DE?
Okay.
And ideally, what would be a good DE?
Right. Okay. So a good DE would include like both a time to observe the child, work with the child, and also have a time to actually have a discussion with the parents to highlight their history. So how we usually would do it would be we would first start out with working with the child.
Yeah.
Usually about 45 minutes, 30 minutes if they're struggling a little bit.
Yeah.
But at the very least, like 30 to 45 minutes. Working with the child, we are basically trying out different things to just look at their skill sets.
Yeah.
So things that I'll be looking for is like, their ability to, interact with me. Are they just kind of like playing by themselves or like trying to engage with me?
Yeah.
I'll sing lots of songs. I'm just trying to make myself really fun
Yeah.
to just see how much will they, pick an interest to
Yeah.
wanting to interact with me. And
Yeah.
I think I'm pretty fun.
Yeah, you are.
So if they don't, then it's like, okay, that's some red flags. If they're
Yeah.
not really like wanting to interact, they're
Yeah.
kind of like playing by themselves. I'm also looking at their ability to like, how much can they speak. Some
Yeah.
kids maybe at the start they might be a little bit shy, like they might not speak so much. But once they warm up, if they have words in their repertoire, they usually will use it.
It'll come out.
Yeah, it'll come out usually. So how much are they speaking? How much do they understand like language as well? So I'm trying to get a gauge of where their vocabulary skills is at, or their language skills are at. How much do they understand? So usually I'll check in like things that are a little bit more concrete, like identification of like objects, or like actions, and then it goes to like more abstract things like. Do they understand what's the function of something, or do they understand prepositions, for example? Then I would also check
and it's, on prepositions note, because it's age appropriate, right?
Yes, correct.
Yeah, you want to match the language
Correct.
to their
Yes.
age, whether they're on track.
Correct. Yes. Yeah. So that's what I'm roughly checking without doing like a proper assessment. Just in general, just checking where their skills are at. Is it matching to their age? I'll be checking their overall like cooperation ability, imitation skills, attention skills, and just like if they're of like school going age already, then I'll be checking like academic skills. Can they read, write? Do they understand numbers or numeracy related concepts? So and of course play skills as well. Yeah. How do they play as well? So these are some of the things that I'll be checking. And then I've read during the with the parents, we'll go through like history taking because autism it has to be present from early development or early childhood. Means when they are very young, right? So we'll basically just checking is there is it something that just has come across now, or
Yeah.
is it something that has been present since like a very young age?
Yeah.
So really checking it. Of course, if they're a bit older, then it take a little bit more time
Yeah.
because you have to like check through a little bit more things. And then of course we spend a bit of time as well then giving the parents some recommendations. What would be like the best, like intervention for them to
Yeah.
support their child, and whether it's, and of course, we will share as well what we are able to do if they have the opportunity to come and
Work
get hours
together.
work together with us. If not, like what should they be looking out for, and what are some tips that they can immediately implement right away at the home. So even if they don't come on board our support, then they are steered in the right direction of how to support this. So some simple tips like what visuals they can use at home, how to manage like certain specific behaviors. Like let's say they're having a challenge with sleep. I remember not in my appointment, but in one of our colleagues' appointment, she was saying that the child was struggling to drink water. So she just gave the simple tip of like, this is a first then method. And immediately the parents try it out, and then they get this actually message and send a feedback that it worked within like few days. so some of these tips actually really is really helpful for the families as well. So
That's
we try to
amazing.
really power pack it and really make the best of the appointment so that they go off like like having some hope and like knowing what to do.
That's so
moving
good.
forward.
And I think it's so true. It is power pack because it's only supposed to be like a 2-hour appointment. It usually goes over time, and the team also like prepares in advance. So parents actually send through a videos, forms, because you guys really, our team, I would say, all of us together really make a lot of effort to make that first appointment successful.
Correct.
You're not trying to trigger the child to see the autism. You're trying to set the child up for success. So we see to see their best actually. And I love how our team actually walks through the diagnosis. So we're not doing this just from our own perspectives or professional opinion, but we're actually using the diagnostic criteria.
Correct, yes.
And we actually then walk parents through, right? To help parents process it and discuss it and see whether they also see the autism or don't either way. So so that's, I mean, I love how our appointments are done. I think they're done well, and I think parents find a lot of hope in them, and then they actually leave feeling more hopeful as well. That's what we would want. But I think what also happens is then a lot of parents ask some very key questions. And what would you say are the top 3 questions that you get in general?
I think in general, some questions that we would get, it would be like, how long will my child need support? Like
They want to see the long-term picture.
They want to know like, is this going to be something that's going to be long-term? That's one. And of course, usually parents would ask like, if let's say the child has like limited speech, they will ask if my child is going to be able to speak. And of course, like school, they also ask about school. And another one would be just in terms of like behaviors, like like will these behaviors go away? Like the stimming behaviors or even the other challenging behaviors, can it be actually overcome or not? So,
okay, so why don't we answer a couple of those questions, like very rapid fire ones? So I guess the first one that you just said, how long will a child need support? I know we might have answered this before, but since we keep getting asked these questions, we're going to answer it again. So don't tune out, tune in, and then share this with someone who may need this information. Okay, what would you say?
I would say first of all, I mean, it's really depending on like how much of a gap do they have. I think what we're always trying to do is we're trying to narrow, or if we can close it, we want to close it, and we want to like narrow that gap. So if they're coming like below, let's say before like primary school age, what we're trying to do is we're trying to like just close as much as possible. So we would say like, okay, if they're coming at like 3 years old, okay, we have 3 years. Let's really try and maximize this time to like, narrow it as much as possible before they go into like a school setting. But if let's say they are, they're coming a little bit later, then the conversation is a little bit different where maybe the gap is already quite big. So on our end, then we will discuss with parents, okay, about the 2 pathways that generally a child would take. Whether it's a developmental pathway, which is like means they are going to go through normal schooling life and just kind of like fade off support eventually. Or versus a more adaptive pathway where it's more, we're teaching more meaningful, functional skills that will be important for day-to-day living. So that will be something that we also would discuss with parents, and that will determine how long of support that they need. Because actually some individuals, they actually learn best in a one-to-one setting. So sometimes actually even though they may be of age to kind of have some level of adapted group, but then they still learn the most in a one-to-one setting. So this is something that we would discuss with parents. Okay, like if let's say resources are not a concern, and the goals that we want to work through are similar with the parents' goals, then the child might continue on for as long as they are able to. But if not, then we'll work with the parents to kind of like transition them into a group setting, whether it's like mainstream if they're going down the route of developmental pathway, or like a more adapted maybe special education kind of like setting as well. So those are, I guess, some considerations in terms of how long support is needed. But if they start young, I think it really depends what age they start. If they start young, there's and of course if they are
the spectrum,
not so affected because it's a spectrum, right? If they are on the milder end of the spectrum, then there is like a high chance that maybe 1-2 years of like intense therapy, and then we slowly transition them into a school, and then we fade off intensive therapy eventually.
And the last we knew from our US parent company is that the government would provide 3 years of ABA funding. So children would go at 2 to 3 years old, and before they turn 6 and go to mainstream school. Although in the US, mainstream school has special needs classrooms already inside. So then that would give us a bit of a gauge, right? But then I think you also then touched on schooling as well, meaning to say like it's not just a when they will go to school, but a what type of school is best. And sometimes we can be fixed with like inclusion, typical school. But we always have to ask ourselves, is that the best environment for that child? And then what about speech? Because we know not all children will be able to become fluent talkers. How do you answer that question?
I think we would first look at like, where is the child's current ability of like speech? If there is some speech, we also look at like some other indicators. Where's their ability to imitate, and how much words do they have, and also how is their roughly the engagement like? Those are like some indicators that gives us some, I guess, clues that they might be able to like, you know, really benefit, really progress in their speech development from like 1 word to 2 words to eventually sentences. Whereas like if let's say they're coming in with like zero speech, on our end we will still work on trying to bring it out, because our therapy, we model lots of language, we do lots of different activities to probably try to bring it out. But if let's say across time we're still not seeing progress, then it's like there's a higher chance that they might not be able to fully develop that speech. So some individuals may then opt to use like the AAC devices, which gives them a voice actually. And actually we have some kids who, from using that, they started to use some words. We just got an update this from just earlier this week that one of our kids who was not using words before, he's like 9 or 10 years old, and he has started to use about 10 words now. But started with us using the devices first.
There you go.
So it's not like we will give up. It's just that we are not going to pressure the child to, you know, speak, because I think that can be quite frustrating for the individual.
I have so many questions to follow up with that. Follow-up questions, because we do get... we have so many parents that are anti-AAC and all of that. Maybe we should keep this for a different topic, a different time. But last one on this would be behaviours then. What's your number one thing that you share in this 2-hour appointment when it comes to behaviours?
I think like the main key thing that I would share is that proactive versus reactive like measures. We train our team that 90%, or even our team and parents as well, that 90% of our energy, effort, time should be focused on, you know, putting in measures before a behavior happens. So things like using visuals, setting the child up to be successful, balancing out demands, like using reinforcement, or like what motivates them to pair up with their learning. All these things sets them up to be more successful. And then of course 10% is just, okay, what do you do if a behavior happens, or when a behavior happens? So that will be, I guess the
framework.
Principle or framework that I would share with like parents, and then from there on I'll usually give them lots of strategies on visuals, because visuals help the child a lot. Like, you know, like when we talk, we are different. Like how I would say something will be very different how you say something, but the visual, no matter what, it's the same.
Absolutely.
So I mean, I've seen with my own eyes like kids that I thought, I wasn't really sure as well whether they would really understand, but from using visuals, they actually understood and they were able to follow. And
so
it's
good.
It's a really powerful tool, actually. Yeah.
That is our dream, that everyone in Malaysia who has a child with autism knows how to use visuals.
Correct.
And every teacher, because I think it will just change our children's future.
Yeah.
Wow.
Agreed.
Well, that's so great, Rachel. I was going to say one of my most frequently asked questions at the moment when it comes to diagnosis is by adults who feel that they have autism. How would we answer that?
That's a tough
It's
one.
tricky one, right?
It's tricky.
Because I've actually been approached quite a few times on this, and at EAP we've done it a couple of times.
Yeah.
But I think I shared that it took so many hours because especially when you said the history, like you had to get the mom in, and then the mom can't remember those early years. And I think that the important line that is in the diagnostic criteria is that it has to cause clinically significant impairment. Right? In their
social, occupational,
and life. Social, occupational, whether that means schooling. And so that's the part that you wonder sometimes, because people then say the word masking, or I was just pretending, or I'm not sure. But then the point is that they were able to go to school. They were able to integrate through most of life. So is it really the spectrum? Does it fulfill the criteria? I think that's where we get stuck. Anything to add on that?
No, I think it's not easy. Especially if the history can't be really traced. But it's something that what you call it, like if we were to have to do a diagnosis, we'll do it very carefully. To really go through a number of assessments first before really take the time to do it before we give a diagnosis.
There have been some adults I have met that they found it difficult to hold a job. They find it difficult to interact with people in general. Then those are signs that I think the child was not diagnosed, the adult was not diagnosed. But I think those that are much more fluent, because maybe their challenge is in relationships. Maybe the challenge is in some rigidities and some maybe obsessive compulsive behaviors that then, because autism is the main word that there's a lot of awareness on, maybe people may unintentionally just lump it under autism, but it may not be autism. It could be trauma induced challenges or personality disorder of some sort as well. So that's where we don't actually do adult diagnosis, but it's always tricky. But hope you got something out of that, and hope that was an interesting discussion around the topic of diagnostic evaluations. I think as we wrap up this episode, we would definitely encourage all parents to still pursue a diagnosis. I know there's lots of waiting lists out there, but definitely even clinical psychologists can do diagnosis. We do them at EAP. Mainly for children, lesser for adults. But we definitely encourage all parents to get the necessary assessment. Early identification leads to early intervention, and that gives children the best potential. And in any case, even if it's not autism, then great. We're just clear that that's not what it is. And we just want to make sure that children get the help that they need. Well, thank you so much for listening, and we'll see you on the next episode. See ya.